Every year, more than 650 million people on this planet live with knee pain. That number is not a typo. It is larger than the entire population of Europe. And the story most of them have been told goes something like this. You are getting older, the cartilage wears down, there is nothing structurally wrong that exercises can fix. You are looking at injections, maybe surgery down the line. Accept it. That story is wrong. Not partially wrong, fundamentally wrong in a way that keeps millions of people in pain they did not have to stay in. Here is what the research actually shows. In studies where doctors performed MRI scans on people with significant knee pain and compared them to people with zero knee pain, the cartilage damage between the two groups was often almost identical. People walking around with severely thinned cartilage on their scans and no pain at all. People in daily agony with cartilage that looks completely normal. The cartilage is not the story. The pain is coming from somewhere else. And until you understand where, nothing you try is going to work for long. If you want health explained in plain language with no drama and no guesswork, subscribe and hit like. Dr. Lucas Veyron's goal is 200,000 subscribers, and you can actually move that number. So if the cartilage is not causing most of the pain, what is? The answer in most cases is a combination of 4 mechanical and physiological errors that have been loading the knee joint the wrong way for years. The joint itself is structurally sound. The way it is being asked to work is not. And the good news about a mechanical problem is that mechanical problems respond to mechanical solutions. You can change what you are doing. Worn cartilage cannot be unworn, but a knee that is being loaded incorrectly can absolutely be corrected. Let me walk you through the 4 things you need to stop. The first is sitting in a low, deep chair for long periods. Most people do not think of sitting as a knee problem. They think of running, stairs, or lifting. But here is what actually happens when you sink into a low sofa or a deep armchair for an hour. Your knee spends that entire time bent at roughly 90 degrees or past it. At that angle, the pressure inside the knee joint climbs dramatically. The kneecap, called the patella, is being pressed hard into the groove on the femur, the thigh bone, by every degree of flexion. Research on joint pressure measurements shows that the force behind the kneecap in deep sitting can be 3 to 4 times your own body weight, just sitting still. Now add the fact that most people with knee pain also have weak quadriceps. The quad muscle at the front of your thigh is the primary shock absorber for the knee. It is what catches your body weight every time your foot contacts the ground. When the quad is weak or poorly activated, that force goes straight into the joint instead of being absorbed by the muscle. Deep, low chairs force the quad to work at its weakest mechanical angle. They load the joint at maximum pressure and minimum muscular support simultaneously. The fix is not complicated. Sit higher. Use a firm chair where your hips and knees sit at roughly equal height. When you stand up, do not use your hands to push off. Push through your feet and activate the quad. It is one of the most consistent instructions in knee rehabilitation and one of the most consistently ignored pieces of advice because it sounds too small to matter. It matters. The second thing to stop is walking on hard, flat surfaces as your only form of movement. This one surprises people. Walking is universally promoted as the safest, easiest form of exercise, and it can be. But there is a specific problem with hard, perfectly flat surfaces for people with compromised knee mechanics. Every step on concrete or tile is a high-impact, repetitive, identical shock delivered at the same angle to the same joint structures thousands of times in a single walk. The cartilage and the meniscus, the 2 crescent-shaped shock absorbers inside your knee, rely on variation in movement to stay healthy. They are not designed for perfectly rhythmic, identical compression on a rigid surface. Compare that to natural terrain: grass, gravel, a forest path. On uneven ground, the angle of your foot changes slightly with every step. Different parts of the joint surface are loaded. The small stabilizing muscles around the knee, the hip abductors, the glutes, the ankle stabilizers, all fire unpredictably to keep you balanced. That variety is exactly what the joint needs. It distributes the load. It trains the surrounding musculature. It prevents the repetitive wear pattern that flat, hard surfaces accelerate. If outdoor terrain is not accessible, walking on a slightly yielding surface, even a firm rubber mat or a treadmill, is better than concrete. Water walking is something orthopedic specialists have recommended for decades, specifically because the resistance of the water forces that muscular engagement without the hard impact. The joint needs movement. It just needs varied, lower impact movement, not relentless, identical pounding. The third is one most people have never been told. It is sleeping with a pillow between your knees and keeping the knee bent all night. Sleeping on your side is not itself a problem, but if you do it with a large pillow between your knees that holds the joint in a bent position for 6, 7, 8 hours, you are doing something the joint hates. Muscles and tendons that cross the knee, particularly the hamstring at the back and the iliotibial band on the outside, are being held in a shortened position for the entire duration of your sleep. Soft tissue that stays shortened for hours undergoes what is called adaptive shortening. Over weeks and months, the tissue loses its resting length. A shortened hamstring increases the compressive force inside the knee every time you straighten your leg. A tight iliotibial band pulls the kneecap laterally out of its groove, which creates that grinding sensation many people describe when climbing stairs or standing from a chair. Neither of these is a joint problem. Both are soft tissue problems created by a sleeping position, and both are almost completely reversible when you correct it. If you sleep on your side, a thin pillow that keeps the knees at roughly neutral, not pulled apart and not pressed together in deep flexion, is enough. Many people find that sleeping on their back with a small support under the knees, not under the thighs but under the back of the knees, provides the most neutral joint position overnight. Ask your doctor what works for your specific anatomy. But the thick pillow between knees in deep bend has done more quiet damage to more people's knee mechanics than almost any exercise I can name. The fourth thing to stop is treating knee pain with complete rest. This is perhaps the most damaging piece of advice in circulation. When something hurts, stop doing it. Give it rest. Wait for it to calm down. On the surface, this sounds reasonable. For a broken bone, it is correct. For a knee that is painful because of the 3 problems we just described, rest is one of the worst things you can do. Cartilage has no blood supply. It gets its nutrients, its hydration, its cellular repair signals entirely from the fluid inside the joint, the synovial fluid. That fluid only circulates and distributes its nutrients when the joint moves. When you rest a painful knee completely, the synovial fluid becomes stagnant. Cartilage cells get less nutrition. The joint stiffens. The quad weakens further from disuse. And within 2 to 3 weeks of complete rest, the exact factors that were causing the pain are significantly worse. What the knee needs is not rest. It is the right load at the right intensity. Controlled, non-impact movement that keeps the joint fluid circulating and the surrounding muscles engaged without repeating the mechanical errors that cause the damage in the first place. In clinical practice, straight leg raises, seated quad contractions, and shallow step downs are often where knee rehabilitation starts. Not because they are difficult, but because they load the joint in the right direction without recreating the harmful patterns. Now here is what to actually do after watching this. Look at every chair you sit in regularly and check whether your knee is bending past 90 degrees. Change the surface you walk on at least 3 times a week. Check your sleeping position tonight and remove any thick pillow that holds your knee in sustained flexion. And if your instinct after a painful day is to rest completely, replace that with 10 minutes of gentle, non-weight-bearing movement instead. Leg swings, seated knee extensions, anything that circulates that synovial fluid without loading the joint at the wrong angle. If the pain has been present for more than a few weeks, it is worth asking your doctor specifically about 3 things. A standing x-ray under load, which shows the actual joint space far more accurately than a lying down image. A physiotherapy referral focused on quad activation and hip strengthening, not just stretching. And a review of your footwear, because worn out shoe soles alter your gait mechanics and deliver extra torque to the knee with every single step. The knee is one of the most repairable joints in the body when the load going through it is corrected. What is broken in most cases is not the structure, it is the pattern, and patterns can be changed.